Well, what if you have sleep issues? So many of you are sharing this morning the troubles you've been having with sleep. In just this last half hour, a listener texted to say, I have been suffering from insomnia on a short-term basis, and I have terrible symptoms, among them depression, rash. Correcting this is a priority because I worry about long-term consequences. And they went on to say, a CPAP machine changed my life and my health. Well, the question I have, how do you know if you're someone that actually should see someone about your sleep? And not just maybe about ways to calm your mind or about anxiety or whether it's sleeping pills or different things, but what about physical problems that could be addressed? Andrew Hoskins is a senior sleep manager with Careica and joins us now. Good morning, Andrew.
Good morning, and thanks for having me on.
Well, thanks for taking the time because I was reaching out to different sleep consultants and managers because I know in my mind, it feels like there's a growing number of people looking for help. Before I ask you what the demand is like, just walk me through, what does Careica do? What are you trying to help with?
Yeah, we actually help with a lot of things as far as sleep is concerned. The main focus that we have is testing and treating what's called sleep apnea, and that's where you have either the pausing or the shallow breathing episodes in the night that can affect your oxygen level and basically subconsciously wake you up enough to be able to breathe through the night, and that can have a lot of long-term effects all on its own. But we also have programs that deal with insomnia. We do dental appliance, which helps with snoring. We have a new device that's called the Excite OSA that deals with snoring. And we also have things like dietitians that will help with trying to get everybody back on track so that we can hopefully help any of these sleep issues.
So, Andrew, I'm curious, what are you seeing? Because, based on the listeners in our audience this morning, a whole host of us are having troubles falling asleep at night. And I know we saw some different trends throughout the pandemic, but how many calls are you getting now compared to, say, a year or two ago?
Yeah, the calls are definitely coming in. More people, I think it's kind of twofold. More people are noticing that they're having some issues, whether it is falling asleep or staying asleep or some daytime sleepiness. But we're also seeing a lot more people that have, heard from their friend, hey, I was having this problem with sleeping and now I feel better. And they're thinking, oh, I'm also having that issue. I would like to feel better too. So the demand has definitely gone up. And unfortunately, a lot of the places and in major cities for sure, the level 1 sleep labs are there's quite a long wait time, so a lot of people are turning to us where we do a home-based sleep study to try and get that screening in and see if we can figure out how do I get this fixed, or is there a problem, and how do we fix that problem.
So how does that work? Is this a private thing where I would pay you money, or I could go on a list and wait for access to the sleep center, say in Winnipeg, or I could come to, say, Careica and pay an amount for an analysis? How does it work, Andrew?
Yeah, that's correct. Yeah, exactly. So you get it referred from a doctor, and then you'd come in and get the sleep recorder from us, and you would take the sleep recorder home. You wear it at home overnight. You bring it back, and then we have that interpreted by a sleep specialist to see what is going on. So
I have a Fitbit that I can wear and it can tell me how I sleep at night. And I'm always shocked. I actually stopped looking at it, Andrew, because it was so upsetting to see how often I was restless at night or even awake. And so there could be, 20 to 30 moments of the night where I'm restless and then 5 or 6 times where I'm fully awake at night. And it bothered me to see it because I didn't have a fix for it. So the data is important. It's important to know that you're maybe not getting that deep sleep. But how often are you finding that it is something physical that you can address, whether it's through just therapy or with one of those sleep apnea machines?
Yeah, absolutely. And I'm glad that you brought that up, actually, because we have a number of people that's their key to go and ask their doctor to get checked. Is that, right. Hey, my Fitbit is telling me I'm not sleeping very well. And the thing is, when we're doing the level 3 sleep test, it's measuring more. Obviously, the Fitbit is measuring your movement and that type of thing. Ours is measuring what's actually going on with flow and whether you have the snoring or whether your oxygen level is actually being affected, those types of things. But we find now, granted, the doctors usually screen before they send to us, but more often than not, we're looking at somewhere in the realm of about a 65% of the people that are referred to us are do screen positive for some type of sleep apnea, and then depending on what their severity is, will kind of dictate where we kind of head with them for therapy.
So I'm just going to say something that's probably going to sound wrong to some folks, but sleep apnea, it's when you have that arrested breathing, right, at night, where you either almost stop breathing or you're snoring very loudly, and your spouse might say to you, you need to go to the doctor because I can't sleep because you're snoring too loudly. And I was under the maybe misconception, Andrew, that this was a male thing and an age thing, that you wouldn't have sleep apnea until you're 60 or 70, and usually it happened in males. What are you finding now?
Actually, and that is the way that we all used to think too. And we're now finding that this is actually broad spectrum. And there's a lot higher incidence in women than we ever thought there was. The difference being usually with women is that they have more of the shallow breathing and not quite the pauses in breathing, whereas in men, we see a lot more where they have the real pauses in breathing, and that's like what you say, where the spouse is giving them the old elbow in the back saying, hey, could you breathe? And they're more worried about it than the actual patient until the patient gets tested and realizes the therapy helps. So we're finding that, but the other part that we're finding is that it's coming across all ages and even body types. I know there was, kind of a belief before that it was only in people who were obese, but we're finding people who are rail thin, but just the way the genetics are, they have smaller airways, and the way they lay down and gravity works, and next thing you know, we have these little pauses in our breathing. And how we measure sleep apnea, we base it on how many times per hour do you have one of those events going on. And anything less than 5 is considered normal, but anything above that is something that we need to treat. And so when I have somebody who comes in who, say, has 10 times per hour, I tell them, I'm like, well, so once every 6 minutes, you're basically pausing in your breathing and being woken up to breathe. So that's why you feel tired during the day and you don't feel very effective.
So the machine is one thing. There might be others you talked about that insomnia. And I'm curious, do you feel that we're starting to take this a bit more seriously? Because for years, doctors have put sleep on the list they'll ask you how you're sleeping. It's one of the 5 questions of, do you exercise? Do you smoke? How much do you drink? How is your sleep? And for some reason, I don't know how many of us just sort of push that to a side. Like, it's fine. I sleep okay. But then you realize years later, that you haven't been sleeping properly. And I'm curious if we're now maybe at a point, yes, I understand you have a business and you're working to help others and you're tapping into a need here, Andrew, but the rest of us maybe need to wake up to this too, because as we've been saying this morning, growing studies show just how it really is killing us, this lack of sleep in our lives.
Well, I think the other part of it is that having this lack of sleep doesn't happen overnight. It's not like one day you feel fine and next thing you know you have a sleep problem, right? It develops over time, and the body is an amazing thing in the fact that it adapts us so well that when somebody asks, how's your sleep? We're like, yeah, well, it's fine. It's normal. But we're finding more and more that there's this focus because sleep apnea and other sleep-related issues can affect things like blood pressure. We can see it affects things like diabetes. We can see that it affects things towards things like heart attacks and strokes. Even dementia is now looking at a big picture as well, as far as being affected by not getting this effective sleep. And as we learn more and more about that, now there's a lot more awareness to do that screening and see what is going on. You say your sleep is okay, but are you tired during the day? A little bit? Could you nap? Yes. We should probably get that looked at, because you just never know. And it can affect so many of those things. And like you said, over a long period of time, if left untreated, those other symptoms are going to become kind of worse and worse. So that's why I think there's definitely that focus being put on, let's actually look and see if we can get this caught before we get to the bad issue.
So with that referral from a doctor to you, then I pay out of pocket for that? Or can any of this be covered by any sort of insurance along the way, Andrew?
Well, definitely the therapy, there is some insurance coverage depending on how that sets up for each patient. And the testing is usually a charge up front. I think there's some that may have some insurance coverage. It really depends on how that sets up for each patient and what they have. But mostly there is a bit of a charge up front, and then you get that done, and then we can see exactly what's going on and kind of figure out what the best route to fix that is.
Andrew Hoskins, Senior Sleep Manager at Careica. Thank you for the time.
Thank you so much for having me. I really appreciate it.
Are you in that category where you have finally said to your doctor, I need to do something for my sleep, and I don't want a pill, and I don't want over-the-counter stuff. I need a permanent fix. Lori, just now, after 32 years of putting plugs in my ears, my husband's doctor said to stay up and check to see if he actually stops breathing. OMG, it was bad, Lori says. Fast forward, life is peaceful at night, and he's a dream to sleep with. He never realized how tired he was. Yep, got on one of those machines, and it made all the difference. Thanks for that, Lori. 780-6868. What has been a fix for your sleeping problem?